calling all orthopods, sports medicine doctors, rheumatologists. What do you do when you've got a patient in front of you who doesn't want surgery and they're not responding to their current physiotherapy? My name's Nell Mead. I'm a physiotherapist. I've been a physio for over 20 years. I was in the army for 10 years and now I run my own private practice in Liverpool Street. And I'd like to tell you a story. It's a story about one of my patients. I'm going to call her Sonal, though that's not her real name. So when I met Sonal, she had been in pain for 2 years with her knees. Firstly, her right knee. And what had happened was she'd got a sore knee. So she'd been to see a physio. The physio had worked with her for 6 months and she wasn't getting better. So the physio sent her to a surgeon. Surgeon very sensibly, MRI scan, realised that she had a torn meniscus. Operated on the meniscus, surgery went well, no problems there, so everything was smooth, the meniscus was repaired and debrided and all the rest of it, everything was fine. Went back to her physio to get her life back, but it didn't work, and 6 months later she was on crutches still, wasn't getting any better, and was still having real problems. So we're now well over a year down the line, she's still on crutches, she's still crying if she's got to move. And so her physio sent her back to the surgeon and said, we're still having problems. In fact, it's getting worse. Now the other knee's getting really bad. She's wondering if she needs surgery in the other knee. What should we do? So her surgeon said, well, you've got 2 possible options. One option is a change of physio, and the other option is a bilateral osteotomy. So she thought about it and decided to try a change of physio, and her surgeon sent me to see me. So when I first saw her, she was on crutches, she came in for a 90-minute assessment session, and she brought what felt like her entire family. She had her mother and her sister and her daughter sitting there. And so I took her into my treatment room while they sat in the waiting room having cups of tea, being very quiet. And I didn't just look at her knee, I looked at all the exercises that her previous physio had given her, which were all perfectly standard, valid exercises to try and strengthen her glutes, strengthen her hamstrings, strengthen her quads, all perfectly standard exercises. But I looked at her whole body and realised that when she was standing, her knees were both in a horrendous position of valgus, and from both of them it was coming from the feet. So her feet were massively rolled in, and So she'd been standing like this in horrendous valgus for a couple of years by this point. And when she shifted her weight onto one foot from the other, her feet actually collapsed even further. So at every step, she was going fully into end of range pronation, which was pulling her into valgus. And so that was putting more strain through her knees at every step. And I realised quickly that was coming from her feet, not from her glutes, which would be more normal. So what I did, in the first session, I got my hands on her feet and we did a little bit of hands-on work. I made her some insoles so she could have a bit more support. And in that first session, bearing in mind at this stage she'd been on crutches for a year, in the first session she walked out of the treatment room into the waiting room, no crutches, and her entire family burst into tears of joy, and I pretty much was there as well. So that was a really good start, obviously. We then, after 2 months, she was able to get on an exercise bike. She was walking consistently without crutches. About 4 months later, she was able to wear high heels at a wedding. And I saw her 12 times over a period of 9 months. And we worked on her walking, we worked on her stairs, we worked on her cycling and her fitness, but we were doing all of it through starting with the feet and starting with her foot strength. And at the end of 9 months, she was done, she was happy, she was able to carry on with her life without pain, and it's now 2 years on and she hasn't needed me. Now the difference was, not that I was doing something miraculous, but the difference is that I've been trained to look at the whole body, not just at the bit that hurts, and not just do the standard traditional physio things. So if you have got a patient like Sonal, who is potentially heading for further surgery or potentially heading for surgery, but just isn't responding to normal standard traditional physio, then please think about sending them my way before they have the surgery, and let's see if looking at the whole body can prevent the need for an operation.